It's definitely not a safer jail. It's not safe for the officers. It's not safe for the inmates, and it's not safe for the visitors that come there.
Nassau County Sheriff Officers Association President Jaronczyk represents more than 1,000 correction officers who say the cuts to staffing and training programs have made the jail a dangerous place to stay and work.
We've been reaching out to the legislature. We've been trying to expose some of the problems we have there and trying to bring the issues to light, that we need additional supervision, we need additional training, and they really need to improve the level of medical care inside that facility.
We haven't had any correction officers disciplined for not doing their job in any of these investigations that we're aware of.
Well, the officers have always followed the procedures that they're told, but when you take a class like a suicide awareness class that should be taught every year and they stop giving it for 2 years, there's no coincidence that for those 2 years that they didn't, immediately after those 2 years, there was 4 or 5 suicides immediately after that.
But officers at the Nassau County Jail have not always followed procedures. In the death of Iman McGinn, January 3, 2010, which the New York State Commission of Correction deemed a preventable death, corrections officers failed to properly assess McGinn's risk factors for suicide because, according to the commission, officers used an outdated screening form. The commission also requested an explanation for why investigators found discrepancies in the supervisory logbook during McGinn's suicide, discrepancies the commission said appeared to be made after the fact. Despite that and 3 other reports recommending investigations into the jail's booking, supervision, and staffing procedures, the Corrections Union maintains that all problems can be traced back to staffing reductions and cuts in training.
In January of this year, for budgetary reasons, they demoted 30 frontline supervisors, 30 corporals, and they removed them from the housing areas inside the jail. That creates a very dangerous situation inside the jail because right now, since that day of January 12th, half the housing areas do not have a supervisor working in there.
To make matters worse, the union alleges that in 2008, 2009, 2010, and recently in 2012, training programs, including suicide prevention and CPR, were cut from the training curriculum as a cost-saving measure. RFL requested an interview multiple times with Sheriff Michael Sposato, responsible for operations and management of the jail. His office declined our request, but offered this statement to questions we sent in an email. His spokesman wrote, in part, "We have not reduced or eliminated any mandated training during Sheriff Sposato's tenure. Suicide prevention training is only mandated for new recruits. Suicide refresher training, not required, was conducted 2007, 2008, and 2011.
I think his silence and his resistance to talk to you speaks volumes. That almost validates everything we're saying, you know, because I know if someone was making these claims against me like we're making against this department, I'd want a chance to rebut that.
But the sheriff is not the only one who's facing allegations of ignoring a deadly problem. According to the Nassau County Charter, the county executive is tasked with appointing a 7-member board of qualified volunteers to oversee operations at the Nassau County Jail. It would have the authority to investigate inmate grievances, inspect the facility, examine records, and advise the sheriff about changes that could improve the jail.
What all of these suicides indicate is that there's just not enough oversight at the facility.
At the time of our interview, Samantha Fredrickson was the Nassau County chapter director of the New York Civil Liberties Union. The group recently filed a petition in state Supreme Court to force the Nassau County executive to appoint the 7 members to the Volunteer Oversight Board. The current county executive, Ed Mangano, declined our multiple requests for an interview, but a spokesman said that the county executive and sheriff cannot discuss the matter because of pending litigation. In County Executive Mangano's statement, the sheriff's office addresses the oversight board. The statement reads, "With respect to the Board of Visitors, although it was established 21 years ago, the board positions have never been filled since that time, and that board has never met. However, there has been and continues to be a jail advisory committee since the late 1980s that serves in a similar capacity. The sheriff convenes a monthly meeting with the committee to discuss whatever concerns and/or suggestions they may have. The statement continues, the department already works with and responds to a number of oversights at this point. It may be that the Board of Visitors was never constituted, as it would just create additional duplicative work and constitute an unwarranted burden on limited county resources.
If the jail doesn't need oversight and doesn't need help with that oversight, then why do we have 7 deaths in the past 2 years?
Pat Delato is a nurse practitioner who worked at the Nassau County Jail back in 2008. As she points out, the death toll at the jail during the last 2 years has actually risen to 7. In addition to the 5 suicides, 26-year-old Antoine Brown of Long Beach died January 8th of this year after being beaten by another inmate. His death was ruled a homicide, and according to published reports, the 7th died from a heart attack after the infirmary sent him back to his cell.
Who are the real criminals here? Are the criminals the people that are housed there, or are the criminals the watchdogs and the people who are running the facility? They are the criminals, unfortunately.
Pat Delato, who now runs an advocacy group for inmates, says she resigned from her position as one of the jail's nurse practitioners in just 6 months because of the pressure to keep sending sick inmates back to their cells. She says it became too much.
I felt pressure from administration because I wanted the care for the inmates that I wasn't able to get for them. And a lot of the inmates would ask for me, they would ask for my name because they knew I was sympathetic to them, and they knew that I would call them down and try to get them their medications or try to help them with their care. And I think too many people were talking about that or asking for me, and I was, causing too much trouble, frankly.